try to make the journey of what you're doing also part of the excitement. Because I think that we too often, or here's the road and here's the prize.
Mm-hmm.
And we're just running to the prize. And then we get to the end. And instead of having paid attention to what we were doing to get there, we're only getting that like dopamine hit from the end.
Mental health has become extremely prevalent in our society in recent years. Whether you're a child, adult, athlete, educator, or professional, the question is, what are some ways can we constantly improve our mental well-being? Joining us today is Vanessa Marquez, a family nurse practitioner who is now a board-certified psychiatric mental health nurse practitioner. With nearly 2 decades of experience in the medical field, Vanessa has dedicated the past 3 years to specializing in psychology. Vanessa is passionate about helping others, focusing on getting to know her patients and understanding things from multiple perspectives. She shares with us her unique insights, experiences, and expertise to help us navigate the journey towards a healthier mind. We had an amazing conversation, and I hope you enjoyed as much as I did.
Vanessa, thank you again for doing this.
You're welcome. My pleasure.
Yeah, so let's start with just telling everyone what it is that you actually do.
Okay. So I'm a family nurse practitioner, and I'm a nurse, and I've recently graduated with a postgraduate certificate in mental health nurse practitioner. So I still have to sit for my boards. I can't call myself a psychiatric mental health nurse practitioner until that happens.
Gotcha. But you're working on it.
But I'm working on it. I just have to take the boards. I
Yeah.
have to take the boards, and but I still work as a nurse in psych, and I also have worked as a nurse in primary care, which is the realm of a family nurse practitioner, and I've also worked in clinical research. So I've had a good, well-rounded taste of all the different types of nursing. We can reinvent ourselves and try other things, which is what I like about nursing.
Yeah, that's awesome.
Yeah.
So what is the difference between being a psychologist, being a counselor, and being a psychiatrist?
So all of them are for the same world of mental health and well-being, but each one has their own training. So a psychologist is going to have a PhD or a PsyD, they call it.
What's a PsyD?
It's
is that
a
with
doctor-
the PSY and
yeah,
a capital D? Okay, I've
exactly.
seen that, yeah.
A doctorate of psychology, and a PhD, which is also geared for academics as well. And they could have also licensing as well. And you could be a therapist by having a master's in psychology, a master's of social work, and in different states they call it different names. LICSW, licensed, different stuff. And LMHFT, I think. There's a lot.
So many acronyms.
So many acronyms, too little time. Yeah. And then a psychiatrist goes to medical school. They're a DO or an MD. That's another designation for physicians. And they have a residency program that they complete after they graduate from medical school, where they specialize as psychiatrists. And then a psychiatric nurse practitioner can do the same things as a psychiatrist. The training is different, but they all kind of end up in the same place in terms of we can diagnose and we can treat and assess and prescribe medications just like a psychiatrist could, except that in 26 states, it's getting up there though, where we can actually practice independently without being under the supervision of a medical doctor that's kind of leading or supervising our work.
Why is that changing? Well, I guess why has there always been someone that has to supervise?
Oh, we're gonna be here a long time. No, just kidding. No. So what's happening is, and this is coming from one of my mentors, who's a psychiatrist, is that, and I have to check on this. Not sure if this is 100% accurate, but I completely trust them. So I'm gonna say it's because there aren't enough places in medical school for doctors to be made.
Okay.
So that's why it's extra competitive. So they need to have people that teach, and they need to have more places in the classrooms. And I believe that number hasn't really increased since this is what I was told, from sometime in the 70s.
Wow.
Like seats for people to apply to become doctors.
I see.
Because the doctors that are working in hospitals, they have to be the ones to teach. And there's more nurses. So we end up having more nurses. So in the future, what it's looking like is we're going to have doctors, you know, kind of leading a group of nurse practitioners in some instances. And that's why, or a group of physician assistants as well. They can sort of specialize. Physician assistants can also specialize in psychiatry.
Nice.
We're like generalists in some ways.
I see.
The physician assistants, as well as some nurse practitioners too. So yeah, so they need more places for, you know, and then the cost of education.
Yeah.
That's a whole other conversation.
Yeah.
We'll be paying until.
Yeah, right. I still have some student loans that I'm just like, I wish that the whole loan forgiveness thing actually panned out or will pan out. I don't know. I just
knock on wood.
Yeah, right.
Yes, same thing for me. And this is why we don't have enough, you know, providers. And in the mental health field, people are desperate right now, especially after the pandemic and the kids not being able to go straight to school and being kind of homeschooled but not homeschooled. Everybody's still, you know, stressed out. Everybody's still sort of collecting themselves from a big event that struck all of us. So that's not just one, you know, it wasn't just one state, one country, it's the whole world. And so
right.
that energy, those social currents are around, and we're all still trying to bounce back from that. And it hasn't been that long. I mean, just recently, and they started to lift the mask mandate. And now I know some hospitals are starting to
return
back.
There are even some colleges that are doing the same thing. Yeah.
Yeah, everybody's afraid because they're afraid of the triple viral effect, which is respiratory syncytial virus, RSV, obviously COVID-19, and the flu. So once you knock down one brick to your wall of protection, you're more apt to get other infections as well. Viruses like to be friends, and bacteria too.
Yeah. So I definitely have some questions about the pandemic and stuff, so we'll get back to that.
Sure.
What inspired you to become a nurse practitioner, and what's inspiring you to go into the mental health field of it all?
So even as a family nurse practitioner, and as a nurse as well, working in primary care, I worked at a federally qualified health center for almost 8 years, and people that are marginalized or that are an at-risk population have a lot of social determinants of health that set them back. And so it's not just, I have diabetes, type 2 diabetes, or, I have high blood pressure. It's more like, I have high blood pressure, I have type 2 diabetes, I have hepatitis C, I have,
like that's all in one person.
Yeah.
Wow.
I'm marginally housed, I'm LGBTQIA, and I'm not receiving support around that. So there's all those factors cross at an intersection, and that's a lot for somebody to manage, especially without support, without family. And so if you're out there not taking care of these issues, they could really sort of, they can really pile on, and the person can have a really hard time trying to get back to a state of homeostasis where things are balanced. So you do see mental health playing into that. Our brains are not disconnected from our bodies. So we are all one unit of all things, and everything affects the other. So mental health is how it's a platform so where you could reach out to people to start retraining their brains to relearn something and get past any of the barriers that they have, and as much as possible as they can, with assistance from therapists and mental health folks. But, then there's some folks who can't. And so those are the folks that are sometimes end up in hospitalized for a long time, or maybe they need to live in a community, in like a community home kind of thing where they have more support.
Yeah. Would helping them and being able to provide some level of support to them, would that be some of the most rewarding things for you when it comes to it, or would it be something else?
It's absolutely the most rewarding. When I was doing my clinical practice, I was in in the South Shore at it's a federally qualified health center, mental health center. It's called the Aspire, and I learned there by doing therapy with some patients, with some clients, that my family nurse practitioner skills came into play, and I was able to blend both of them. And the doctor that I was working with had also worked, the psychiatrist had also worked as a primary care physician previously, so he recognized also, he's like, that's right. But, to be able to blend all of that. And I'm not saying that everybody needs to be both a family nurse practitioner and a psych NP, but it certainly helps, right? You're able to see how to put the pieces together and how to provide the right support for the client or patient.
Nice.
Yeah.
Nice.
So that's very rewarding to me. I come back feeling, my heart is full, and I don't need gratitude from anybody, because the gratitude's being generated from myself.
Right.
Yeah.
Right. I feel the same way when it comes to coaching gymnastics at times, just kind of seeing the excitement or happiness that a child would get when they get a skill or when they overcome a certain fear. So I definitely see that.
It's very similar. You're not driving the bus for them. You're just sort of providing a map or guidance on their journey. And so that's really exciting to see people get better, or people, master something and really push through the difficult times.
Right. Yeah, they'll thank me, and I'm like, you did the work.
Yeah,
you did all the hard work. I was just
I was coaching
I was just saying words, but you did everything. So,
yes. Yeah. And I think with anything, with gymnastics, with mental health, with trying to master anything new, even as infants, there's always a period of discomfort. Mm-hmm. And that discomfort, once you get past it, is what makes things go more like on an automatic level after that, right? Like driving a car. You spent a lot of time learning all the rules and taking tests and having somebody watch you while you drive, and so you're tense. You're tense, and you're thinking, oh my gosh, I'm not gonna make it. I don't do this so well, blah blah blah. And you have all these things going in your head, and then eventually you just start driving, and it's automatic. You don't even think about it.
Right.
And so it's a muscle memory with anything. So I think that most of us, even as we get older, if we can just remember that with anything new that we're trying to master, there's a level of discomfort, because you don't know what you don't know.
Right.
So with any of that, you're gonna have a level of discomfort, and as we age too, it could be longer before you master that.
Yeah. Awesome.
Yeah. Mm-hmm.
What is the difference between mental illnesses and a brain disorder? Something, I don't know if you've worked with people that have Alzheimer's or that have dementia, but I just learned that those are considered brain disorders and not necessarily a mental illness.
Right. So there's the factor of, is something triggered by an illness. So anytime that clinicians in the mental health realm have a client or a patient, the first thing they want to do is rule out that it's not something that's not something from like an injury or a tumor or traumatic brain injury or another disease related that's affecting their mental health, because that can certainly happen. Like people that have traumatic brain injuries could have anger outbursts and stuff like that.
So it's like a concussion.
Like a concussion can cause can cause that. A tumor can cause that. If you notice someone that's baseline, is not an angry person, and isn't like charging at everything and getting really frustrated with everything, you have to wonder, like, why is this sudden change happening? And those are the things that we want to rule out as clinicians.
Right.
That's really important, because you don't want to say, oh, this person has it might be schizophrenia or something related, and it turned out to be a tumor that you overlook. So all parts of the medical world and mental health world have to come together to evaluate that and make sure that you're not missing something else.
Yeah. Okay. So in the population that we work with in terms of kids, we get a lot of kids that that have ADHD or ADD. I'm not entirely sure what is the correct acronym, or I don't know if there's. I was told that they're different, and then I was also told that they're the same, and that one of them is just more modern than the other.
Yeah.
What is the difference between the two?
I think they're calling all of them now. I think they're calling all of them ADHD.
Okay.
Even though, and then there's different levels of it. There's ADHD with like hyperactivity, and which is the H, but not everybody's hyperactive. And so they're all different.
So that's why they're
they're all different levels. Yeah. So when we go, I mean, this is the boring part of my job. When we go to code something, we have to be able to closely pinpoint what flavor of ADHD a child has, or an adult has too.
Yeah.
So more people are coming forward to get neuropsych evaluations, or they start to really think about their childhood if they're adults and go, oh, I remember not being able to sit still and squirming, and and sometimes it definitely is ADHD, but sometimes it could be anxiety related or depression related, because those things can also mimic. So with kids with ADHD, doing sports is great. It's one way to navigate or to maybe ameliorate some of their symptoms and sort of put their energy into something that they could have support around, and they can have, they could see results, that kind of thing. But also I think that it's a poor misconception that people have that folks with ADHD are not intelligent or they can't really concentrate, because if you have someone with ADHD and you just put in front of them their most, favorite sport or topic, they will latch onto that and tell you all about it.
Wow.
Like detail.
Yeah.
They can really see the details of that one topic that really interests them. And so you won't lose their attention. That's for sure.
Right. So that's one of the things that I was actually going to ask you in managing kids that have ADHD. Very often they're looked at, like you said, unintelligent, or we deem them as, oh, that kid just doesn't listen, when that may not be the case. So what are some ways we can help support that child when they're in a class and in gymnastics? While things can be fast action, there are times we need to slow things down a bit and explain to them something specific. And in those moments where they need to be hyperactive or they need to be moving, what are some tips that coaches or educators can do to help that child in that moment?
Well, pay attention and definitely do your research. There's a lot out there for helping support kids and adults with ADHD. I want to be fair. Adults get it too.
Absolutely.
Adults get it too. There's a lot out there to support. Just make sure that what you're looking at is something that's been validated, that's peer reviewed in the research. Because people like to say, I researched. I researched, and what they really mean.
But they went on TikTok.
They went on TikTok or Google, which Google's great. Google Scholar's great. Like, all those things are great. And then also to pay attention to how many people were in these studies, right? So the smaller the number of people that are in a trial of whatever kind of trial, then
you want to kind of take it with a grain of salt.
Yeah, take it with a grain of salt and say, okay, there's something there. And even in those studies, at the end of the study, that'll say, in conclusion, ADHD needs to be researched at a grander level with, a larger number of participants in the study, that kind of thing. So I think that's, one way to do it. But really, to support is listen to them. Try not to put too much in front of them at once. And the other thing, and I think this is good for everybody, not just kids, and not just kids with ADHD or adults, but to try to make the journey of what you're doing also part of the excitement. Because I think that we too often, or here's the road and here's the prize. And we're just running to the prize, and then we get to the end, and instead of having paid attention to what we were doing to get there, we're only getting that like dopamine hit from the end.
I see.
I won, or I mastered it. But I think it's important that, and it's hard, especially like at my age, when you've already, trained your mind and lived your life a certain way, it's hard not to look for the next event kind of thing.
Right.
Instead of saying right here, right now, what am I enjoying? What am I liking about what I'm doing right now?
I see.
And what am I grateful for in this moment? And what can I improve? And being excited about that part, those steps, there has to be some sort of reward in your brain for you to get as excited about it. And it also helps you pay attention.
Yeah.
It helps you pay attention. It helps you focus. So
it's kind of like making, like, for example, if we're teaching a skill or whatever it is, but making a big deal of the small things that they're succeeding at, even though they might not have gotten the full skill, they made just one simple correction, or if they just did something different.
Yeah.
Making a big deal out of like that moment.
Yeah. Right. And to get them to reflect on what they think it could be better. Because that way, if it's something that would be, I don't know, say dangerous, or for sure as the coach, that's not going to work kind of thing, but you still want them to get that out, to be trying to problem solve that in their minds too, so that they can have some input into what's going on. And that really, I think, gives everybody more like, oh my gosh, this is exactly what I was thinking, and I'm right, or something to get you excited about it.
Awesome. So for those that are neurotypical and neurodivergent, is there a way to teach them control of their body, when at times, again, in those moments where they may not fully understand that there's a moment that they need to focus on something, and they're just in their own minds and moving? Is there anything practical that we can get them to do in that moment, to something over time that we can help teach that concept of controlling your body and being in the moment for just a little bit? And then
I remember with my kids and friends getting the wiggles out, like getting all that energy out, like getting them warm up. That might settle them more. But I think this is a bigger question and I think a lot of people don't know this, is that they have specialists so you can go see your child can go see their therapist, and can also, if they have ADHD, they can see a therapist, and they can also see a behavioral therapist, which helps to teach the child different strategies to manage that. And I don't think enough people know that they're out there. But on the other side, I don't know if that's covered by insurance or
right.
Yeah. And we certainly need more of those experts out in the field too. We all have to work synergistically to be able to address all the needs that, children and anybody that's having struggles need.
Nice. Is there a certain personality trait that works well with kids that a lot of people may not know, or that a lot of people may not be doing, when they're working with kids? Is there like a certain way to talk to kids that is much more favorable, that you've started to notice over the years, or what you've seen in researches? And
I think, with smaller kids, with elementary school kids, kindergartens, first grade, I think sitting down, getting at their eye level with them to speak to them, not to tower over them and look down at them, because that doesn't work. And, not to baby talk, obviously, but break things down for them in a way that doesn't have big jargon, but also in a way that respects their intelligence too, because really their brains are so malleable. They can absorb so much and really learn so much that we have to make sure that we are even keeled ourselves. And I think in a classroom or in any situation with kids, being even keeled is going to be the most productive way to communicate with them. Because if we as the adults are all over the place and we're moody, as hard as it is not to be sometimes, then they don't get a sense of stability. So kids kids like schedules even though they think they don't like schedules, because it's almost like a certainty. This is what's happening next we do this, then that. And so I think with someone who's leading, a group of kids, that being even keel and firm and fair is going to be the best way. And sometimes, sometimes we can't always manage our own selves.
Right.
That's hard enough as it is.
Right. You mentioned kids' minds are malleable. Are there ever situations where a kid may not be able to learn something because, like, biologically speaking, their minds are wired to just think a different way or act a different way, and that's kind of it, and kind of same thing with adults as we get older, how they say stuck in your ways. Is that actually a thing? Are biologically speaking, are we actually stuck in our ways, or is evolution and growth, well, I guess not, but growth, is growth possible within our minds?
Sure it is. Even when you get to, there's people that are in their 90s, and they're still learning something new. And that's called neuroplasticity. And so, yes, things can get more rigid and set in our ways as we age, but even from childhood on, like, our brains can do some amazing things that we don't know all of it yet. We don't even know the half of it yet.
Right.
But I think that, there's some things that gifts, right, that some people are going to be better at than others. But with patience and guiding the child to understand that not everything's going to come easy to them. And you just have to remind them. I would say, oh, so Jonathan, remember how when you first started to learn how to X, and then now look how good you are, and then try to remember all the steps and all the practicing you did to get there, to get good. And so you kind of have to draw parallels with previous experiences that they have. Because what I noticed with my own child when she was little, every time around the time she was going to turn another year, 1, 2, like a few months before and a few months after, whatever her new level of practical things that she was mastering, she would get really frustrated. And of course, that's harder when kids don't know how to use their words, right? So
right.
So you have to remember that frustration and anger, those are all feelings that come up from underlying things. Like, if you're angry, it could be because you're scared, because you're disappointed. It's not just because, I'm just going to get angry to get angry.
Right.
And sometimes kids can't use their words to express what that is. That doesn't come later until later developmental stages where they start to master that.
How do you help them through that? How do you help them figure out what those words are?
You listen, and you validate what they're saying, and you get them to, once they're in a more calm state, that they can tell you what's going on by you asking questions, and try not to overwhelm them too much. Is it this? Is it that? Because they're not thinking at that level yet.
Right.
So you just get, and it's usually around some, feeling disappointed that they can't do something, or, like learning to tie your shoe. I like just, and they'll fling their shoes across the room. I can't tie my shoes. Well, everybody, you have to remember, they have the different methods to teach kids to tie shoes, but that's what I mean. That's the discomfort. And even as adults, because most of my schooling and training has been as an older adult, not in my 20s, like the traditional path. It's been mostly after I turned 30. So I was definitely having moments where I was hitting that discomfort, and it was taking longer to get past it, to master something. But just like that, as soon as I pick it up, I can do it. Maybe I can't do it as fast as somebody else or as good as someone else, but that's not the point, right? Like, you have to challenge yourself, and to have that sort of motivation, you have to realize that you've been able to do other things that you had to, push past the discomfort and the struggle to get it, even the smallest thing.
Right. And sometimes it's hard to remember that especially when you're young, it's hard to remember that that whole thing is part of that growth. Like feeling uncomfortable is part of that growth. And it's at times it's difficult to fully lean into that, because obviously nobody wants to feel uncomfortable. Nobody wants to feel like something is difficult, and because it can lead to disappointment and all that. So it must be tough for them to understand that as they get older. Like, I'm trying to think of myself when I'm, as I was younger. I'm just thinking, like, what was that process for me like? Coming to the realization that growth really comes from being in a uncomfortable position. You have to be able to self-soothe. And I think that's really hard because at least now I feel that mental health is at the forefront of everything. We have people that are role models that are stepping out and saying, like Simone Biles a couple of years ago, right? And she stepped out off of a competition and said, I need to take care of my mental health. And a lot of people were kind of booing and, people saw it as a sign of weakness, but I saw it as a sign of strength because we are human beings and we're not machines. We're not meant to just keep going and going and going and pushing and pushing. And I think that's that culture and that mentality, that stigma that comes along with, I need a break, I need a mental health break kind of thing is starting to not be so stigmatized anymore. Right. Still not to my liking, but still. And then what was the what's her name? Osaka, the tennis player. I think she did something similar. Naomi Osaka.
Yes.
Yep.
Similar, right? And I think they are courageous for talking about it, and they're being exemplary role models in that. And that's what we need to teach kids, because not everything you do in life is going to be about you winning. You also have to know how to lose. You have to know how to take care of yourself. You have to know coping skills. And especially as on a world stage like that, you have to know how to cope. People usually don't think about these things until someone completes suicide. And they say, oh, what could we have done to help? These are the things somebody can ask. How are you? Is this too much stress? Do you need a break? And we have to ask ourselves that too, because no one thinks as much about us, ourselves, as we do. Right. Just when you're like, oh, they're all thinking this and that. No, you're thinking.
Everyone's thinking about themselves. Everybody's self-absorbed.
Exactly. We are. That's like so I was telling you earlier before we got on camera, that's like a protective mechanism, right? You remember the bad things more than you do the good things that happen sometimes, because you got some arousal in your body about it, and all your dopamine, everything just comes and like, okay, tiger's coming, we're not going to pet the nice kitty. Run, play dead. And so I think that's why we remember the bad things too, but also because it's self-protective, right? Oh, if I put my hand on the stove and the fire's on, ouch, it's gonna burn, so I need to withdraw that. So I think some of these things are automatic in our bodies, or something that's biological defense kind of thing for the environment that we are in. And so I think that's the same thing with not stopping to ask yourself, hey, I've been going really hard with my body, with my mind, with whatever it is you're doing. I need to take a break. And that has to really come from you, first and foremost. And it isn't a weakness. And it isn't, I've heard people say, mumbo jumbo, psychobabble, blah-de-blah, Yeah. And that's so wrong, and that's such a throwback of being in the way of thinking, and kind of being in the shadows about all of us have struggles. All of us have struggles. All of us have a need to be understood. All of us have a need to be nurtured and cared for, but we also have to be able to do those things for ourselves. And Simone Biles and Naomi Osaka just said, I'm taking care of myself. Right. And that's really powerful. Right. And the more folks we get like that, whether it's an entertainer or, politicians, whoever's out there on a stage that has a big platform that does these things are setting the tone for everybody else to be able to speak up for themselves too, and not feel badly about it.
Right. And what do you think that process was like for them? What would you imagine that process was like for them to overcome that? I don't know if Naomi Osaka returned, but I do know Simone Biles has returned to competition, and I would assume she's met with sports psychologists, or that, you know, she's gone through therapy. I don't know if she's met with, you know, we don't know any of these things, but what would you imagine that process is like to be able to overcome what she was feeling, you know, a situation where she was what it's called the twisties, not really understanding where you are in the air and having that be such a mental thing. How do you overcome something like that? You know, what does that look like?
You really, I think, I mean, I don't know what she was thinking, but
Sure.
if I were in her shoes, I would say I have to put myself first. This is not worth having a major injury that's going to keep me from doing this more or doing other things related to it. So I have to put myself first. And, you know, I have to just tune out social media and paparazzis and all the people with their own opinions, because in the end it's about taking care of yourself. So I think I would imagine that that's what she was thinking, you know, because it isn't worth it. It isn't worth it. It really isn't.
Right. And I guess it just might be hard to speak to the work she might have done to overcome that. I think so. Putting yourself first. Now, does putting yourself first look like having to kind of dig deep as to why she may be feeling that way and trying to answer some of those questions? I don't know. It's just I'm trying to figure out how she would have really gotten from not being able to do it and then being able to do it. Was it just the time? Was it?
I think the time, yes. And I think she probably has a good support system too. You know, I'm sure her family, her managers, and you have to put your foot down. And I think also with so much coming around mental health, it just adds to it about, you know, reducing the stigma and standing up for your own mental health as well.
Right.
Yeah.
Okay. You mentioned earlier anxiety. It seems to be a trend that, you know, in America, a lot of people are increasingly being, you know, diagnosed with anxiety disorder. Why do you think that is? Why do you think, you know, has it really just been social media that's really spiked that increase of anxiety disorder?
Well, aside from the pandemic and the stress of that, I think just many people were stuffing it. I know that generations before me, you know, oh, pull yourself up by your bootstraps. You know, I'm not going to go talk to somebody else about my problems. I can solve my own problems, kind of thing.
Right.
They don't understand how therapy works. So, or how, you know, seeing a mental health specialist works. So that fear keeps them, because it's always been associated with something you don't talk about. Oh, you don't want to talk about that. You just keep that to yourself, keep it behind closed doors. And so I think now people are talking about it more. But with anxiety, I think we've always had, I mean, the more technology we have, the more things in our lives as a society, as a species, the harder, I mean, the more anxiety we're going to have about these things.
Right.
You know, cell phones, social media, computers, AI, gizmos, gadgets, you name it. So on the one hand, it might be making our lives easier in one way, but on another, we're all anxious about, a lot of us could be anxious about that technology or learning to use that technology or what it's doing for you or not doing for you. And I think with anxiety, you know, there's getting anxious and there's actually having an anxiety disorder.
I was just going to say, what is that difference between having those normal life stressors, right? Feeling anxious, and, you know, that's very momentary. And then there's anxiety disorder that seems to be a little bit more, you know, chronic and long term. How do you differentiate the difference when both feelings are the same and when it's also very different. Like anxiety disorder can look different per individual.
Yeah. So anxiety disorders are diagnosed by clinicians in the mental health realm. They could also be diagnosed by your primary care person as well, your primary care clinician. It has to meet certain criteria. So it has to affect the individual's activities of daily life and or their relationships with other folks in their world for a certain amount of time in the past couple of weeks is usually what they ask. And it has to be something that's keeping them from going to school or going to work or getting along with folks or paying their bills, or maybe they're, going shopping and just, all night shopping and spending money they don't have kind of thing. Like those kinds of things that's affecting the individual's functioning. And so that's what would be considered a mental health disorder of anxiety.
Okay. And having it affect everything going on in their lives, is it because, I guess, what are the different things that they might be feeling? Would it just simply be fear? I know we've had, I've met people in the past that literally that's what it was. It's like their body is just, or their mind is afraid of something, and there really isn't anything for them to be afraid of, but their body's just afraid. Is there anything else other than fear, or how else might it show up?
So fear, rumination, like just can't let go of thoughts, but fear's a big one. Being, as we talked about before, about feeling like you didn't accomplish something, and so you're disappointed in yourself, and then you start ruminating about those thoughts. Or on the other hand, if you have such a fear of people, say, then you could end up having agoraphobia because you're not leaving your house because you don't want to go deal with people because you fear people, and it's like a cycle. And so when you get to that point, it's harder, and you have to get more involved with exposure therapy, where a therapist comes in as one way to sort of to support that person or to help get past that, is to be exposed in little bits to something that reminds them of the fear, because they need to get out of the house to be able to go to work, to go to function.
Right.
Yeah.
Okay.
So there's anxiety, and then there's eustress, which I
what
think...
What is eustress?
Eustress. I think it's spelled EUSTRESS.
That I've never heard of.
So eustress is the thing that, it's that little bit of stress that you feel before you sit in front of a camera and start to talk to somebody else, and you're like, everybody's going to watch this. It's going to come out. That's eustress. And so those are the things that motivate us to, get out there and get a job, interview for a job. That's like really hard for a lot of people.
Right.
You're sitting there talking to a stranger, and that stranger wants to find out, will you fit into what you're doing at this organization? And you're sitting there thinking, oh, I hope they pick me. Or what if, all these things can, that's eustress too.
Interesting. Okay.
It's
so
eustress.
Literally in coming to the podcast, and I literally wrote it in my notes because that's how I was feeling, in that I was very nervous, to do this podcast today, because one, I was just very busy over the week. So in getting prepared, it was really tough. And now that we're doing it, I'm just like,
hey,
everything's gonna be okay. I'm on the other side. It kind of is what it is. However it's going to be is how it's going to be. So that's all eustress.
Exactly. That's all the eustress. The stuff that you felt before sitting down, and even the stress that you might feel about putting this together and editing it and figuring it out. But that's kind of like, we need that stress. We need that little push that gives you a little bit, to kind of challenge yourself and get past that. Yeah. And I think those are all normal, or whatever normal feelings are of most folks, I believe. Yeah. Yeah.
Wow. I'm happy to put a term to, and then, okay, we're here.
Hey, as long as that moment doesn't stop you from, feeding yourself, taking a shower, going to work, then it's fine. And then there's a little bit higher than that could be anxiety, when, if you can't go to sleep, you're worried about being worried. It keeps you up at night. And I think everybody goes through that, even if they don't have to have a disorder. But what we all need to do is figure out what is the best way that works for us to cope with that. Whether it's doing, going for a walk, a run, or meditating, or talking to a friend, or writing, or watching a movie, something, some way, some sort of way that we're able to ease that, and that we're able to have our own dialogue with ourselves, telling ourselves, okay, brain, thank you for kind of, lighting that fire under me, but I got this. And you have to talk to your brain almost like it's another person.
Yeah.
Hey, brain. Because I think there's things that, and I know that this has been found in research articles, and, scientists talk about this. I've heard that elements of our brain are just like it's a program already. And so we kind of have to speak to that program that's been there from the beginning of, people kind of humankind, and it's there for a protective reason. It may not serve a purpose anymore, so we have to find a better way to manage that, that other self in there that's the program. We have to challenge the program in there.
Would that fall under overthinking?
It could be, yeah. I mean, it's, sometimes we my friend used to say this, we've catastrophized imagined futures, and usually it's never as bad as we think it's going to be.
Right.
It's usually.
And at times there are things that just kind of work out.
Yeah.
Like
that work out, and you're like, oh, why was I so worried about that?
Right.
So we have to remember those things. We have to remember those moments, because those moments can be applied to the next time there's something that's similar. Right. And I think that teaching kids how to cope with loss, how to cope with failure, how to cope with winning, how to behave when you're a winner with something, with all of that, how to cope with other difficult people that don't have coping skills.
Right.
And how to deal with that. And all of those things are really hard, because...
Or even how to like manage your emotions when you have friends in your same level that could be advancing, or that could be a little bit, not advancing as quickly as you are. Trying to figure out those emotions, I imagine, would be tough for them, and they just kind of need that support and understanding how to cope with that.
Yeah, that's really important. Yes.
Yeah. Awesome. How about social anxiety and being shy? Like, is social anxiety, is that something that has to be diagnosed by a clinician as well? Or
I mean, usually parents can see that in their kid, or an adult can sense that in themselves, and the diagnosis is not the person, but it's all, what I mean? Like, it's not the way, what needs to be addressed, that needs to happen, doesn't have to have a label, but it helps to, like you said earlier with Eustress.
Yeah.
And you still have to be able to motivate that person to help themselves.
Right.
You're going to do something, they call it motivational interviewing. And it's to try to get that person to think about their own barriers and how they can get past it, and how they've overcome other things that were barriers to something else, and to draw the similarities. But ultimately, that has to come from the person, not the therapist. I think a lot of people think, oh, I'm going to the therapist so they can tell me what to do. It's not how that works.
Right.
You don't sit there and go, hi, therapist, so what should I do next? Because they're going to say, how did you do something else? They're going to ask you questions. It needs to come from your own mind. It really does. It has to come from your own mind in order for things to work. Because nobody else can jump into your skin and make you think or move or do things that you don't want to do yourself. Right. Yeah.
What do you do in those moments that a therapist may have a client that they don't know how to do that? They don't know how to make those decisions, I guess, for themselves to figure out what it is that they actually need to do. Are there suggestions that the therapist gives, or?
Oh, of course. Yeah. There's suggestions that the therapist gives. And, if it's something to do with, if the person has some developmental disabilities or other academic challenges or something like that, then they definitely try to link them up with other resources for help on that. And sometimes that has to happen.
Is anxiety curable? Is that something that's just only treatable over time, or is that something that can actually be cured?
Well, you can't, I mean, a lot of things don't have a cure per se. There's a management to it.
Yeah.
But yeah, certainly people after time can develop coping skills, and anxiety is a thing of the past. They'll even say, I can do it. Anybody can do it,
And that's because they've learned how to just manage it.
They learn how to manage it. They've worked on it. All of this is work. Anything that we need to unlearn or learn is going to have that same thing, which is the discomfort. And that part is what keeps people from doing things, because they don't want to feel that discomfort. They don't want to be the person in the room that doesn't know how to do something as well as the next person. They don't want to have to ask questions. They don't want to mess up and make mistakes. But that's what has to happen in order for you to advance to the next thing, or to get past what you need for yourself. Yeah.
When is it recommended that someone goes on medication for it? I guess, how is that decided?
So there's a lot that goes into it, and it just depends again on how much it's affecting or impacting the person's daily life and relationships. And some of the medications that they're doing now is going to be something, they're going to trial you perhaps on an antidepressant, even though it might not be just depression, but that's usually one of the medications that has shown to work best. And they're going to try and stay away from benzodiazepines unless it's, more urgent. It's all going to depend on the person's presentation and what the clinician, there's no one size fits all to prescribing. And, while two things might look the same on the surface,
it may not be.
It may not be. And their circumstances and support systems might be completely different. And so that's all the factors that a clinician, and there's also biology, there's also heredity, there's also genetic factors, like how many people in their family, mother, father, sisters, brothers, grandparents have X, and so all of those things factor into how they're going to prescribe a medication.
When they're actually prescribing a medication, again, I know it's very different. Are there times where the right medication may not be known? Are there times where it's
definitely.
Let's try to see if this works, and let's see how your body responds to it?
Yep. There's trials. I mean, there's trialing with your clinician. And I'm talking about the clinical trials, but there's trialing within your clinician, because maybe some of those medications that work for the majority, you might happen to be the outlier for whom it doesn't work. And so what I like to say, and other of my peers like to say, is not that we failed that medication, but that medication didn't work for us.
I see.
And a lot of people say, oh, such and such, they failed the trial of X, Y, and Z medication, but it's the other way around.
So, there are definitely people out there that are skeptical when it comes to medication. Are there any non-medicated evidence-based interventions that
There's a lot of CBT, they call it, which is cognitive behavioral therapy. That's been on the psych stage for many moons now. And I mean, we're still, if you think about it, we're still sort of in the infancy of the psychiatry, psychology. Things didn't really, people think back of Freud, and and that's where we start, and that wasn't that long ago in the grand scheme of time.
Right.
Things have changed so much. They used to be called, what were hospitals called? Sanatoriums or something.
I did not know. They were called sanatoriums?
I think that's what they were. Yeah, they didn't, they had names and things, and they had, people were locked up and padded rooms and like all these different things that I think people still sort of equate with when they think of mental health and the extremes.
I think of the getting kind of, what are those things
the
called?
Straitjacket.
The straitjackets. Yep. And just being in a room of pillows, and it's just like everyone that has a mental illness is like that's what everyone thinks about.
A locked door,
right,
and with a small window.
Yep.
And
getting food through a little hole.
It is not like that at all. I mean, we have come a long way from that. You won't see that anywhere, at least not in the US. I'm certain of that. Not in the Western world.
Yeah.
Thankfully.
Yeah. Anything else other than CBT?
There's also sorts of different types of therapies out there.
Okay.
And one of them might speak to you more and work for you more than another. The unfortunate part is that not everybody's has health insurance, and not everybody's health insurance is going to go with everything out there. But I definitely think don't give up. There's something out there that's going to click with you and could work for you just as well.
Yeah.
But I mean, I think in terms of whether medication or, usually what we all think about, and this is part of evidence-based medicine, is that for a lot of mental health issues, having therapy, talk therapy, and a medication is better than just one or the other. And you don't have to be on them for life, the medications. You can trial, once you get to a part where you feel stabilized, you can trial tapering off of a medication. And the same thing with therapy. After a lot of therapists, however they arrange their, what the combination of skills that they're going to use to help the person, they might say, well, you're in a good place now. Maybe we can have a maintenance therapy session. So you go once a month or once every 3 months or twice a year or whatever the case may be. But I think that's also a good way to stay connected.
Yeah.
Because for me, I think therapy, it's my guide. Yeah. My therapist is my guide.
Yeah.
I don't need to see the therapist every week but I feel like it's my way of staying tethered to the skills that I learned and not losing my way.
Right.
Yeah.
And is slowly, reducing the time that you're seeing a therapist, would that be considered a graduation of sort when it comes to, like, is there ever graduating out of therapy?
I think it just depends on
or a positive, I guess trying to think of it, like, is that a positive thing?
So I think being in therapy is a positive thing. I don't think you have to wait for, at least not for me. I don't think you have to wait to have, because you think you have a mental health disorder. There's so much going on in our worlds now that I don't think humans were, we don't have that program from back in the Stone Age, that having therapy is a good thing. And it's not something that I am going to graduate from.
Something you're going to consistently keep
it's maintenance.
In your life.
For me, it's self-care, honestly. It's like getting a massage or like going to a steam bath. That's what it feels like for me, like self-care. But yes, there definitely might be some therapists that you're doing. I've heard this expression from therapists say, we're doing a piece of work here, which is, there's a beginning, a middle, and an end, and you're trying to get to a certain level. And it just all depends with the therapist and what you discuss when you're doing an intake with them.
Yeah. Before we move on to the next topic, just real quick, just to put a button on the medication. Do you know how mental health medication works? Only because I asked because I know with like pain relieving medicine, that the medicine essentially stops the signal, the pain signal that travels to your brain, which I think is pretty fascinating. Does medication for mental disorders work the same? Like, how does that? So
they're not creating something new in your body per se. Okay. What's happening is they're turning something on or they're turning something off.
I see.
Or they're turning some things off. One medication might turn some things off and some things on, or it might keep it from going in either extreme. Oh, okay. And that's pretty much, and so all the different like dopamine, serotonin, and there's all sorts of different letters that they start to like break down into norepinephrine, all of that. The medications don't introduce something new into your body in terms of something that's not already there. Usually it's about either turning it on or turning it off, or regulating it, or keeping your brain from getting rid of something that your brain needs. Like in the case with serotonin, for example, they're called SSRIs. They're antidepressant medications. Like Prozac, which in some, sadly, it works for lots of people, but sadly there's a stigma around it. A book that came out about it, and it doesn't work the same for everybody.
Yeah.
But we need all the tools we can get, in my opinion, all the tools we can get that have some efficacy and they're safe for people there, so we can have something, you know, we can have a tool to help people.
Yeah.
And so sadly, some of these things do get bad press because it didn't work for somebody, and that's their experience and it's valid.
Right.
But it could work for somebody else. And I think a lot of the companies that the drug companies that make this spend a lot of time and effort and, you know, human brain power to come up with them. And the FDA regulates all these things, and they go through everything with a fine-tooth comb, and you have very few, I think, in the grand scheme of things, very few moments where you read about something that, you know, went horribly wrong with a medication, because they're really being trialed and they're really being put to the test in every way possible.
Yeah. Let's talk about technology.
Mm-hmm.
How has that impacted kids? My niece, there was a moment where, you know, she gets very zoned into her tablet, you know, and at times when she's really focused like that, nothing else matters to her in the world. And, you know, she was supposed to be focused on something in that moment that her mother was trying to have her do, and her mother was just like, hey, you know what, I'm gonna take the tablet away because you're not focusing. And she just had a complete meltdown.
How old is she?
I think she's 5 now. She's 5. She must be 5. Is doing something like that taking away a hobby that they enjoy or something that they really like? Or is there something deeper happening just around an attachment that, you know, we're developing with technology?
I think a lot of kids, you know, 2-year-olds, I've seen them pick up an iPhone or, you know, any kind of smartphone, and they know what they're doing.
Oh, they know their way around it.
They know their way around it. I think that's just a part of what's going to be it's integrating into our lives. Hopefully our fingers don't start to morph because I have cell phone hand now.
You know, it's funny when, you know, I don't know, back in the day where you would act like you're on the phone, you would go like this. Right now, you tell a kid to do that, they go like this. I find that so funny that they do that.
It's kind of like the old phones, though. It'd be like this.
Right. So it's literally, you know, transformed over time.
Yeah. But I think, I don't think it's a bad thing for them to use that. I think it's great because, you know, they engages a certain part of their mind, but they also need to do exercise. They also need to engage in other things. So
that's what she did. You know, once the tablet was away and she kind of had to do what she needed to do, she found different ways to occupy herself. She played with her sister. She went outside and did all of these different things. So, yeah, I don't know. It makes you think, you know.
I think modeling too, like modeling for a child. If you can see your own parents or older siblings putting something down and saying, okay, I've had my 1 hour of this, now I'm going to go do that. Then I think that's always one of the best ways, because they always follow with the older child. What's the big girl doing?
Yeah. So essentially setting time limits on
and making it in a way that's positive, instead of saying you only get 1 hour and that's it. Right. No more, or else. That's not going to do anything. Right. You're just putting fear into a kid, and you might have the complete opposite effect. You might end up with a child grabbing onto the tablet for dear life and having a complete meltdown because you're taking it away. But if you present like, oh, well, now now it's time to, I know you really like this, but we're going to do this other thing right now, and we'll come back to the tablet maybe later or maybe tomorrow, however it is that you have arranged for your kid to have their sort of electronic time.
Yeah. Now, many social media platform leaders have, like, it's known they don't actually allow their kids to use those platforms, at least at a very young age. Do you know why that would be? Or
what's that? What do you mean?
So a lot of, like the Mark Zuckerbergs of the world, and I can't think of another person. I can't think of another person right now, but as they have kids, they don't actually allow them to use social media until they're much older. I guess, do you have any insight on why they're doing that, why they're holding them back a little bit? Because, the rest of the world, we're all on it.
Oh, yeah. I'm not sure. I mean, maybe because they know all that goes behind it.
I was going to say, is there something that they're not telling us?
No, I don't think that's it. I don't think that's it. Maybe, I think sometimes we project onto our kids what we, some of our own hopes and dreams, and that's not always the best thing to do.
Yeah.
Certainly we all want our kids to do better than we did. But maybe they want, dad's doing it, so I don't want you on social media. But then there's also a lot of negative stuff around social media.
Right.
There's retouched pictures and feeling like you have to be competitive or constantly comparing yourself to what appears to you as something perfect in a still image.
Right.
But that's, what people need to remember is that anything you see on social media, even what we're doing now, this is a window in time, a still moment in time. If it's a picture, it's still just a moment in time. It's not the whole life of Jonathan. It's not what you were doing a few hours ago. It's not expressing your feelings in that way. It's not saying how how did I look this morning, and what was I doing, and what was I feeling. Right now, this is the moment that we're having. This is a still picture of time, even still. So I think what people need to see is that so many folks now spend a lot of time procuring a certain look. And for example, I went to India to travel in India this past summer, and everyone, all the park ranger folks and everybody that worked in there, and even other tourists, they all knew how to, which way to take a picture in a cool way with your smartphone so that it'll appear like this or like that. And there's so much time spent on that.
Yeah.
And so that's and that's fun. I have absolutely nothing against it. I think that's great. Like, you have an eye for something and you want to indulge, that's perfect. Just like we're doing this podcast, right? Yeah. But it's spending your time comparing yourself to these images that are snapshots of other people in their moment where they've set everything up just right shouldn't be, it can do a lot of damage for a child or even adults that are impressionable or that might already have a baseline depression or anxiety, and they're like, oh, I can't seem to do what so-and-so and so-and-so are doing in these beautiful crafted pictures. So that could be the reason for I'd be like, no. But even if I'm not the owner of a company that's doing social media, I don't want my child on social media 24/7.
Right.
And I definitely want to have conversations about, like the one we just had.
Right.
These are snapshots in time of that person's, well-crafted perfection. Doesn't mean, because nobody walks around perfect.
Right.
Nobody.
Except on social media.
Exactly.
We can curate it how we want it to look.
How we want it to look, exactly.
Yep. Now, a lot of different platforms, like actual individual platforms, would have like a sponsorship from things like from telehealth companies like what is it called, BetterHelp, Talkspace, things like that. What are your thoughts on those companies? I know there's been some negative, I don't want to say negative. There's just been some concern around actually using their services at times. And so I know telehealth is good. It's a great thing, for people that can't actually go someplace and get that therapy. Yeah, I don't know if you can speak on kind of like the BetterHelps of the world.
I've seen it, and I think I worked at a company where they were offering it, and I never actually used it because I had my own therapist. But I think it's great. I think that we need those tools, but also I don't think it should be in place of also having face-to-face time with somebody. But also I think that we're desperate for clinicians, that we're desperate for resources for mental health. And so I don't see the harm in it, as long as, I think, especially for kids, I think if the parents are involved or the caregivers are involved and they know what's going on, that nothing gets missed. In other words, that you didn't just say, oh, well, they're getting therapy, so I don't need to worry about anything else. Because that wouldn't be true even if in person.
Right.
You still have to be behind the scenes monitoring and sorting out what's going on.
Right.
Yeah.
I didn't even think of kids using BetterHelp or Talkspace or even telehealth. I don't know why I didn't think of that. So on the topic of social media, what are some misconceptions or some wild, crazy, outrageous things that you've kind of heard that are just not true or just not accurate, or that we just really need to be mindful of?
In terms of?
Just any misinformation.
I think one of the things that,
just around mental health.
Yeah, around mental health, it's not misinformation, I would say, but just a myth. And the myth of being able to pull yourself up by your own bootstraps. The myth of we don't need anybody else. You can fix your own mental health, and that might be true in degrees of what's going on for that person, but nobody's their own island. We all need each other. Yeah. As much as we annoy each other, as much as other people can be really annoying. I'm never annoying, but other people are very annoying. As much as other people can be really frustrating sometimes, we still need each other.
Right.
And so we all have to figure out a way to get along. And that might sound very idealistic and Pollyanna, call it what you want. It's a fact. Nobody, unless you're planning to go on a little island by yourself and you don't want to talk to anybody else ever again, then okay, sure. But you know what? That's not the way things work.
Right.
Humanity, humankind, we're here to be around other people.
Yeah.
And when there aren't other people around, evidence shows there's higher rates of suicide. There's higher rates of depression. There's higher rates of anxiety. And I think I'll draw that back with COVID. I think that's what happened in COVID. My daughter would have started high school during the pandemic in 9th grade, went for a few months in person, and then everything turned to being online.
Yeah.
I mean, when I went to 9th grade, when you're a teenager, when you're an adolescent, when I was an adolescent, these are the times when you're making friendships, you're establishing relationships and learning how to support each other and learning how the world of, mini grown-ups, how that works, because eventually you're going to be doing that outside of high school.
Yeah.
And doing that online just doesn't have the same
fact.
No, it doesn't. Yeah. It doesn't have the same feeling. You still feel like very isolated, I think. Right. And so a lot of kids were struggling with that, and then parents were struggling with, kids being at home. How many videos did we see, memes where the mom's on a Zoom call and the kids in the background saying, Mommy, I pooped my pants. Yeah. And they're like, wow, they're fighting and stop trying to electrocute your brother. Yeah. But I think all of that, it was just like, it kind of pressure cooked all of us. And even for people that, maybe we're used to it, like people living in New York City, I remember that hearing about so many people leaving the city because it's like, if I'm going to work from home, well, I pay so much high rent to be living in a closet.
Right.
I'm going to go out to like the country.
And those homes are tiny.
Yeah.
I've been seeing some, literally we're talking about social media. I've been seeing some different apartments and things like that in New York and how they're going for astronomical numbers. And you literally have 400 square footage of space. Yeah. And it's just, you're paying $3,000, $4,000, $5,000 a month just for this. It's just like, are you serious?
Yeah. It's the same thing I saw in San Francisco. Like every time there's a new cycle of new technology happening that draws, young folks and all folks from everywhere that want to get involved in that. I've seen, apartments where there's like multiple bunk beds, and you have to chain your belongings to something,
to your stuff, so that way it doesn't get taken.
And you're really just like, you're kind of squatting. It's kind of like a hostel instead of a really an apartment. You have roommates, but you might be perfect strangers that, all huddled into this one room with 4 bunk beds or something. Yeah. So I think all of that that sort of brought out the best in us in some ways, the pandemic, and also the worst. Mm-hmm. And also I think showed us that we need other people. We really do need other people.
Right.
And then thawing out from being locked down was also hard. Like people, I went to visit my family in New Orleans, and I saw people just losing it for small things, because I think we also stopped practicing on how to deal with each other. Yeah. And so I saw people just be on a, just a little tip, and they were like, freaking out about something. But I think
because there was just so much uncertainty. And
so much uncertainty, so much isolation.
Yeah.
Even from our own loved ones, right? Like my in-laws live in the next town over, but they're vulnerable, so we didn't want to bring COVID potentially, so we didn't go visit. Yeah. But yet they need the visiting as much as we do. We want to see them. We want to be able to hug. I mean, did you see some grandparents like made these like sheets, these like plastic sheets they would hang in the door, and they would hug their family through those sheets? It was so sad to see.
That is sad.
Like, but that's how badly we need human contact, and we need each other.
Yeah.
Or, people would go visit the elderly grandparents or parents at a nursing home, but they would sit outside of a window and wave to each other. Like, that broke my heart into a million pieces. Like, that was so sad. Mm-hmm. But we need that more than anything now, especially now that, things have calmed down a bit. Knock on wood, hopefully.
Yeah, hopefully. Hopefully we don't. It was such a weird time, and I'm just hoping we never have to go back to that again.
Same here.
Yeah.
Same here.
Let's talk about the workplace. What can companies do to improve mental health in the workplace? Mm-hmm. What are they not doing?
Mm-hmm. So I see a lot of companies talking about diversity, inclusion, equity, equality, psychological safety, and I think it's good. It's at least being brought to the table, but the real work has to get done. Psychological safety is really important in the workplace, meaning that everybody can contribute and they feel safe in contributing. They feel safe in speaking up, and they don't feel like they're going to get squashed or shut down because they have a thought or an opinion. So that's all considered psychological safety. Okay. And companies are also offering group things, not for the employees individually to go to group therapy, not necessarily with their coworkers, but like I think it was one of the ones you mentioned earlier, a company that I worked for was just rolling that out.
Okay.
And encouraging employees to use the EAP, it's Employee Assistance Program. Okay. And that's usually like a resource that helps you get linked in with counseling or whatever kind of support that you need. Mm-hmm. But that's usually the thing with that, is that it's usually part of really big companies. Yeah. Really big companies that have deep pockets.
That can
they can afford that, and they can get a bigger discount because they have 90,000 employees or whatever it is. Right. So that's really hard. But I think also modeling, and in a smaller company, the CEO or the manager, the owner, modeling, that's really important. Modeling how you talk to people, and bringing that up and giving people a pat on the back. That's important. Just like what we were talking about before, like the journey to get there. Yeah. It might seem like an insignificant thing, but without those little things, you can't get to the finish line. You can't get to do the dismount or whatever it is that you need to do. Yeah. You can't stick the landing without having gone through those little steps.
Yeah.
And so I think that even though many of us can be ultra modest and say, oh, I don't need to be, it kind of might even feel like you're being patronized in a bit, but you do need that. You do need to hear the positive as much as the negative.
Right. There are, when you're an owner or leader or manager of some sort, it's definitely on that individual to make sure that they are giving out those positive feedback as well. How can the owner or the manager or that specific leader, how can they get that for themselves? How because there isn't, the employees aren't going to say, hey,
hey,
great job. Because again, as we spoke about earlier, we're all self-absorbed. We're all kind of thinking about our own things. And, the manager or the owner, they have to think about everyone else, and be unselfish in that way. So how can that individual focus on their own mental health, in addition to thinking of everyone else's?
Yes. Yeah. I think there's, groups for executives or for business owners, or in pretty much any sort of field, there's groups, there are groups, support groups for that. That's important. It's important to have, if you don't, maybe you have a business managing consultant or somebody that can help you and say, oh yeah, you're charting a good path here, good job. And also I think when you treat your employees and the people that report to you well and model how to do that, eventually they start going back. They'll start pulling them aside. I really appreciate the way that you X, Y, and Z last week. It made me feel like I can do this, and I'm glad that you see my success as your success as a team. And those things, I think that's really important. That's an important way to do it. Yeah. And just also, as a manager, also know that it's not always, you get to be the heavy on everything, and it's not always going to be all the glory too. But when your business is going well, I would imagine that that's a reward in and of itself too. Right, You're like, hey, people are happy, they're showing up for work.
Right.
Because one of the things that, that is well documented in all sorts of labor and statistics studies is poor management or unhappy employees causes a lot of sick calls, and I don't feel well because my manager makes me feel nervous and I don't want to go in today, or whatever it is. I'm just going to get yelled at again today. That's no fun. So people don't show up. But if people are showing up and they're productive and they're smiling and they're happy, and then that's a reward, I think. I don't know in a business, not yet anyway, but I think that would be part of the reward for me. For sure.
So how do you think employers can help foster that culture where employees are happy, and that they are actually excited to show up consistently? And would it just be like what you were saying, just a positive
I think so. It's
feedback?
It's being positive. It's remembering that we all need, for as much as it hurts sometimes, is feedback. And feedback's not always going to be positive, but to try to keep a balance in your mind about that, to try to remember that sometimes we don't, we have to be content with the person trying and doing something the best way they know how, especially if we don't have it laid out. This is how you do it, and we have to be content with that. Say, hey, you know what? It got done. And it's maybe not the way I would do it, but if you're a small business owner, you can't do everything. You need other people. Right. So you're just going to have to be happy with the way somebody's, have gratitude for somebody taking on the task and doing it to the best of their ability. Because sometimes, just in most cases, we have our own brains. Not everybody, unless you have some protocol that's been written and tried and true. But if you just pretty much gave a task to someone that doesn't have a particular, way of getting done, and it gets done, and not, everything's good, then hey, you have to applaud that.
Yeah.
And that's also a way to manage your own expectations too.
In coaching, one of the things that we try to do is we have different individuals shadow us, or we'll let them know how we do things, just so that they can have that in their toolbox. Sometimes they'll take what they saw, they'll take what they've learned, and actually try to apply it and figure out how they can implement it within their own personality, within what they bring to the table. And I think that's very important, because nobody's going to be like me. And I can't be like someone else. However, I can see what they're doing and say, okay, how can I do what they're doing, create that same effect with what I bring to the table. Other times people just copy or don't actually work towards figuring out how to be their best selves. What are some ways we can motivate that person, other than just saying, oh, I'm here to collect a check? What are some ways that person can be motivated and kind of seeing everything that they're doing as a greater picture, for seeing the bigger picture of what it is that we're doing here, as opposed to just saying, hey, I'm going to come here, I'm going to do just enough to get by. And
so there's extrinsic and intrinsic motivation. I think what's out there is, in the research world of this, intrinsic is better, right? Because intrinsic is yourself motivating. Extrinsic would be like you have a carrot and you're holding a carrot in front of somebody and they're chasing that carrot. Yeah. But I think if, and this is hard, it's easier said than done, to create excitement, to create sort of interconnectedness between the people, between the team, build the team. That's the best way to get people excited and motivated, I think, because we all need that. Right. Is to be understood. Remember, everybody wants to be understood. Right. We all think more about ourselves than anybody else, but we also want to be understood. Right. And I think sometimes you can you don't have to spend a lot of time on it. You can show somebody that you understand them and appreciate them. And it doesn't have to take a long time. And I think that can create excitement and enthusiasm about what's going on. Yeah.
Have you heard of the trend happening in other countries, or I don't even think it's a lot of other countries, but the idea of a 4-day work week?
Yes, I have. I think even like years ago, I think France has something really, like it's 30 full-time there's 30 something hours.
Oh, yeah. So I know that even the 5-day work week was a change from way back when it was a 6-day work week or something like that. And
was it? I didn't know that.
Yeah. I forget the guy's name, but he's the one that
I think for sure there were times where you just worked.
Right.
Yeah.
Yeah.
You just worked, and it didn't matter how old you were. If you were a kid, they didn't have any labor laws and stuff. Yeah.
So I forget his name. I'll probably plug it in the video, but he championed having a 5-day work week. So instead of coming in 6 days a week, he was like, we're going to do 5 days a week, 8 hours a day. And that's what started to, get popular, and because they started to see that people were much more productive and much more happier. And now we're revisiting that and saying, hey, let's look at a 4-day work week. What are your thoughts around that?
I think that's great. I mean, there's industries where that works. And I mean, not that it couldn't work in, say, a hospital that's open 24/7, that's serving people 24/7, and people can have 4-day work weeks, I think. I mean, in nursing, for sure, that we have 3-day work weeks. You can work 3 12-hour shifts. It's 36 hours in 3 days.
Yeah.
And then you're done. But, it just depends on I think it depends on the industry. But in order for it to all shift into it being the norm, we all have to start doing it. It's the same thing. We all have to start doing it, supporting it, modeling it, showing how it works. And then, of course, people are like, show me the money.
Right. I was going to say, I'm sure it would take a hit on the economy.
Yeah, but
different businesses having to close for 3 whole days or things like that.
Oh, like the stock market or something like that. Yeah. But I think we're the ones that these things are kind of arbitrary too.
Yeah.
No one says that. There's no written rule somewhere
That it has to be
that
this.
you must work.
Yeah.
This, being open is different, like in
Yeah.
terms of a hospital, like I said. But I think that we create these social norms about work, and we have to be the ones to change it.
Yeah.
And I've seen other things change really fast and other things take forever to change.
Yeah.
But if we lobby for them, if we push for them, I think
Yeah.
it can happen.
So is there a way to talk to kids about mental health? How do we introduce those ideas to them? Is there a right age to do that?
I think from the very beginning, I think, when you're helping kids use their words.
Mm-hmm.
A lot of the use their words is because they're having a fit about something and
Yeah.
they
Don't know how to vocalize
and they don't know how to.
it.
And I think that's when you start. I mean, you're not going to sit down and talk to them about, the stages of Erickson's stages of development or anything with them. But you're going to start to model for them. And I think that's the biggest thing. Again, modeling. We end up doing a lot of what our parents do.
Yeah.
Yeah, I definitely catch myself feeling like, oh, I just made an expression and just something just like, I feel like that would, if I could put a mirror in front of me, that looked just like my mother or just like my father. So we even in the way we walk.
Yeah.
I was watching my husband walk next to his father. I'm like, oh my gosh, they have the same, like the way that their gait was
very similar.
Was very similar. I could see that there. So I think we learn a lot from our caregivers.
Mm-hmm.
And I think that it's possible to model all those things for them.
Yeah. So in modeling that, what are some things that parents can do to model their own mental health? That way their kids can kind of see that within them over time. So
in my house, like if I have, for example, like a disagreement with my husband, it's, we sometimes we do like everybody else does, know, but most of the time, if that happens, like, all right, let's take a break. And then our kid has witnessed us. How do we resolve things in the end? And that it didn't escalate to a certain level.
Yeah.
And I think that's where it starts. Like nobody puts hands on anybody. No one, how that's the things that the kids need to see. And that's relationships are how we learn how to cope, how we learn how to deal with other people. And that's what, I think that's a big part of mental health.
Yeah. And how do they focus on their own individual mental health? What are some things that they can do just individually, just to kind of think about themselves? Because, having a family, I'm sure, is a lot. It's a lot to maintain, and having a job and all of these different things.
Oh, you mean the parents have a mental health?
Yeah.
Just checking in with each other. I think checking in with yourself, like we talked about earlier. Like, hey brain.
Yeah.
Hey brain, you're having a little bit of a moment here. You're stuck on that topic. We're moving on from that now. Thank you for looking out for danger for me.
Yeah.
But there's no Bengal tiger there. I need to let this go, and now I need to do the next thing.
Right. What are some recognizable signs in children that we should be looking for when it comes to potentially spotting a mental health issue?
Withdrawn, bedwetting after a certain age. Those could all be signs. Things can manifest in different ways for kids. Just, keeping an eye on them and just knowing what your kid's baseline is. And if something's amiss from baseline, parents know. Caregivers know. Whoever spends the most time with that child, like, instantly, nope, something's off.
Yeah.
They don't even have to say a word. It could just be a look.
Right.
They looked at you a certain way and you're like, something's not right. So keeping an eye on your kid and just knowing when something's amiss. And I think that's instinctual.
Yeah.
For most caregivers and parents.
Yeah.
When you've been with a child, you're like, something's not right here. And addressing it. And if you can't, don't wait to find a therapist or a mental health particularly. Go to your primary care person. They're the best, they're sort of the gatekeepers, and they're going to be able to help you just as well and to keep things from going going out of sight, out of mind kind of thing, keep it in, talk to your providers.
Yeah.
Yeah.
What are some success stories that you've heard in the past of, different patients or different people that, well, I guess you mentioned it with Simone Biles and Naomi Osaka, but any others that might come to mind for you?
I mean, I saw the other day a group on Facebook, of course, social media, that was celebrating people for being sober for X amount of time, which so many times people with substance use disorder, when you see sometimes if they, they're picked up by the police and they're for whatever, and they have a mug shot and people will just rip through some poor soul's picture. Oh, look at their mouth and look at their teeth and look at how their hair looks and how they're falling apart. And then they have all these derogatory names as though substance use is a choice. Right. As though somebody wakes up and says, I can't wait to be addicted to X. Yeah. And then throw my life away and be homeless and, get picked up. This particular group celebrates people for being clean and sober. That's which awesome. I think is really great. And it goes back to that thing again of like
the journey,
celebrating the journey. You can't just sit around imagining yourself at the finish line, crossing the ribbon tearing a ribbon across your chest as the winner. You have to imagine every step there. Right. Find the joy. And I think for me, that's really hard. Yeah. So I'm with a lot of talk right now, but it's really hard to be in the present moment and saying, I'm learning about this. And this is just as much fun as I see myself, or just as exciting as I see myself being at the end when I'm done with the training or whatever. Because thereafter, then what? Do you just that's it? You just, nothing else is going to happen? No, every day you have to find, I read an article, a friend sent me an article about you have to find the glimmers in your day. Mm-hmm. And I think that's one of them. What
I like that.
And
I think glimmers in your day.
Yeah, the glimmer in your day. What was today? And even if you're fixated on the negatives of that day, because that's really easy to do. Yeah. You should try, at least I try, to find the glimmer. And I have through my teeth upset about the negative, and I'm like, well, at least today I didn't get rained on because it stopped raining when I got out of work. Yeah. Whatever it is. Or
at least today I put on my shoes on the right foot.
No, exactly. I didn't walk out with 2 different pairs of clogs this morning before I went to work. Yeah. So those are, no matter how small, because it's hard to, once you're grateful for something and just saying it, just being grateful for having, the same shoe on the same style shoe on both feet. Even when you say that to yourself, when I say it, I'm taking ownership of that. When I say that to myself, even through my upset about whatever it is, or my anger or frustration, it still makes me laugh. It still makes just talking about it. So it's like saying smile and say something really nasty to somebody. It's incongruent. So just the act of smiling kind of makes me feel better anyway. Yeah. And I know it's the same for a lot of people. Right. I dare you to get mad at somebody and, tell them all about themselves while you're smiling. Right. It just doesn't work.
It doesn't.
It's your body, what you're doing with your body and what's going on in your mind start to want to line up regardless. Yeah. Yeah.
Awesome. Are there any exciting developments or research in mental health and psychiatry that's coming up, that's kind of up and coming, that you're excited about or that you're looking forward to? Something that's promising or anything like that? Of any?
There's what I like in that realm is how people that have been in the field for a long time, or even if they haven't, even if they're new and they bring some new awareness or some new method or, some new way to combine what's already out there and and it works for people, I get excited about that.
Yeah.
Because that's just, again, one more tool in the toolbox of resources for folks.
Yeah.
And what works for you might not work for me, and so on and so on. Of course, most things that are in medicine or in life in general, it's all about the bell-shaped curve, right?
Right.
So if it seems to be good for the big portion of people here in the middle, then it's going to be implemented or put out. And there's still outliers on both sides that it isn't going to work for.
Mm-hmm.
So I think it's great. I think it's great to innovate on that. I've seen lots of apps. I don't know how good they are. I know some of them are a little expensive. I've seen apps for ADHD, apps for procrastination, apps for all sorts of stuff. And I think that's great because we spend time, again, another tool. As long as you don't become just addicted to that one thing or just stuck on your one app for everything, and you know how to use it in a balanced way, I think those are good things. I'm excited about that. I know it's also hard though with some of the apps that are coming out, probably go through a lot of work around HIPAA compliance, the Health Portability Act, and keeping private health information or personal health information private. And not having it leak or not being hacked. But any tool out there that we can try that's not going to hurt, why not?
Right. Awesome.
Mm-hmm.
What are your suggestions on someone who may be hesitant on going to see a therapist? What do you suggest that they do to maybe find a therapist who, someone who is like, where do I even start? What do I even...
Oh, well, there are great resources. There's one that a lot of people use, psychology.com, and there's they have a magazine for it as well. And in the back of it, there's, or throughout, I think I haven't looked at one in a while because I've looked online, but you can find a therapist there. And you can figure out, there's lots of folks with podcasts or with clips that say, if you're looking for a therapist, here are my top 10. What's it going to hurt to watch one of those?
Mm-hmm.
Think about how you want to be supported, and also with the reality that there's a shortage of providers, but figure that out and talk to people, and don't be afraid to say, I'm not comfortable with that way. Can you, and all of us as providers in this are happy to refer or help you find somebody else that will speak more to the style or work better with the style that you're looking for. But without taking those first steps of looking or asking questions, looking for the helpers, because there's people out there that want to help, you're not going to find out.
Yeah. Awesome. Thank you, Vanessa, for joining us today. This was really awesome.
This has been great. Thank you so much, Jonathan.
Of course.
I hope to come back.
Oh,
we
of
talk
course.
some more.
Yeah,
There's so much to talk about.
There's so much that I wanted to mention, but I, just realized that we've been going for a while.
Yeah.
And so I'm just like, okay, this is a good place to end.
Yeah.
So.
Okay. Thank you so much.
Thank you.
Okay.
All right.